Hey, everybody. I want to talk about confidence and commitment, mastering the peptide conversation for patient success. I hope you guys were able to join us for our peptide webinar. If you weren't, please do leave us a comment, peptide webinar, and we'll get that over to you. The confidence gap. Confidence is everything. Uncertainty kills. When a team hesitates or lacks deep protocol knowledge, it signals risk to the patient. Uncertainty is the primary killer of momentum and conversion. Certainty closes cases. We always say the difference between close and lose is the C, and that's confidence and certainty. Confidence is contagious. When the team owns the conversation, they create a safe environment for the patient to commit to their health journey. The psychology of commitment, why confidence is your most valuable asset. Confidence creates commitment, and that starts with trust. Expertise builds an immediate bond of professional authority. When they see that you understand not just the protocols, but them, and that you have worked with other people like them, that builds that trust. And the momentum is the smooth deliveries that prevents patients from second guessing the process. So have all of these things lined out very well. How are you going to onboard the patient? What are you communicating with them? What knowledge do you have? And does your team have on the peptides, the protocols, the benefits, the indications, the contraindications? In order to be successful, you need to have this drilled into your team and practice, practice, practice. Results. Commitment leads to compliance, and compliance leads to outcomes. Not just outcomes for them, but also referrals. When a person is winning and other people in their lives see them winning, it's going to get other people asking them questions. Oh my God, you look so great. What are you doing? Gosh, you have so much more energy. I see that you're doing better out golfing or playing volleyball or pickleball. People will notice who are closest to you, and people want what you have, especially when it generates good outcomes. So execution, we want to tighten the delivery. Strategy for selecting and mastering your core protocols. I'm going to go over a book with you here shortly. I'll have a picture of that. But I want to talk about the three-pillar framework. What does the peptide solve? Clearly define the primary pain point or the goal the peptide addresses. Then, how does it work? You have to be able to explain the mechanism of action in a very simple way without all the medical and clinical jargon. We always say KISS. Keep it super simple. Who is it for? Identify the ideal patient profile to ensure the perfect match for therapy. This will also help the rest of your team to identify other people that you're currently serving in the office who might be a good candidate. And the morning huddles or your meetings would be a great time to discuss patients, because obviously your staff isn't going to be making those protocols outside of the doctor of chiropractic or the nurse practitioner or physician's assistant, whoever you have. But the whole team needs to know this because they'll see people in their personal life, their friend circle, out and about, that they can start promoting and talking about these wonderful peptides too. So the KISS method, we talked about that already. Keep it super simple. Complexity is the enemy of execution. In medical sales, if the patient has to think too hard, they say no. If they don't KNOW, they say no. So if they don't know, they say no. Your team must be able to explain complex biochemistry in 3 sentences or less, which I'm going to give you an example of. Simplicity is the ultimate sophistication in patient communication. Some of these things sound like Chinese to our patients, so we don't want them to operate off of fear or uncertainty. We want them to have a knowingness and certainty that they are in the right place and that you have the right service for their specific need. The Ultimate Peptides Bible, pick this up. It's on Amazon. I think it's like $26. It will go over protocols. It will also go over stacks with you because peptides are so hot right now, and peptides are really new on the scene. Most people are uncertain of the protocols. There are great protocols and stacks that you can do for each individual, either symptomology or for each type of peptide that's being offered right now. So the Ultimate Peptides Bible, you can get that on Amazon. I think it's $25 or $26. When we say KISS, keep it super simple, and how we need to train our team to be able to communicate these things is BP 157. What does it do? It helps with joint and tissue injury. It accelerates the natural healing signals. It's an anti-inflammatory. Who's it for? Athletes, post-operations, any acute injuries like I have one right now from playing volleyball last night. Another example is semaglutide. Metabolic health. What does it do? It solves metabolic health issues. How does it do that? It regulates the hunger hormone and then also blood sugar. What is it for, or who is it for? Those who are looking for weight loss results. So I hope that helps. You can do that. There's over 100 peptides currently that we are working with. So if you are interested in peptides, please leave us a comment, say peptides, and we will get you some information. So leading with certainty, you want to own the room. When you own the conversation, you remove the burden of decision-making from the patient. They aren't just buying a peptide, they are buying your certainty and the clinical certainty, or the clinic certainty. And that is in their recovery. Again, the right protocol for their specific condition. So pick one protocol this week, study it, practice it, master the delivery until the team speaks with one unified voice and authority. Team mastery roadmap. Select 1 to 2 protocols each week and drill those in. Do a little workshop on that. What is the KISS method? Keep it super simple. What is it indicated for? What is it contraindicated for? What's the benefits? How does it work? And then what is the result? Role play and objection handle. Go live and track the outcomes of that. Once you start hearing the patient's results, your team's going to come on fire. And when your patients start having the results, their family and their friends and their coworkers are going to see that. So make sure you ask for referrals. This is something that's forgotten so often. When people are singing your praises, ask who else do they know that would benefit from the same type of care. Commitment begins with your first answer. Are you ready to tighten up your team's delivery? If so, make sure to comment peptide webinar. We'll get that to you. And if not, put peptides in there and we will get you an order form so you can get going in the right direction. Make sure you go to Amazon, check out the Peptides Bible. It's probably the best $25 you'll spend for your clinic. We'll see you next time. Be blessed and be a blessing.
If this helped, give this video a like and share it with someone who needs this.